The first samples of COVID-19 arrived at the UHAS lab on Monday morning. That was few minutes after the Volta Regional Minister, Dr. Archibald Yaolecha, and MP for Ho Central Constituency finished touring the new laboratory. The sample is received at this spot and disinfected, and then taken upstairs to the laboratory. Head of Biomedical Science at the School of Basic and Biomedical Sciences at the University of Health and Allied Sciences, Dr. Kwabena Duedu, explains the process.
This is the holding area for food boxes. So the food boxes come, we put them here. We have disinfected the boxes down there. Okay. We've made this provision just assuming that there will be many of them coming. Okay. So this is the area we hold them. From here, we move them to the next bench where we do the sorting. So we open the food boxes, we have the sample forms and all that we cross-check to make sure that every sample is coming with the information it requires. And the number of samples is also the number of samples which it says it is. If it isn't, then we need to liaise with the regional directorate or the health facility involved to be able to get whatever information that we need. Some of the challenges that we have in laboratory diagnosis is accompanying information. Yeah. So it's very critical that we have adequate information on the sample before we even test. Because when we test and you don't have adequate information, the test is useless. So we make sure that we do that on this middle bench.
Dr. Duedu also noted that the sample remains are stored for a long period to help with sequencing and other researches.
More than just the diagnosis. Okay. We currently also have the capability to do sequencing. I think not long ago, University of Ghana did sequencing of some of the sample. Okay. We also have that capability to do the sequencing as well, which is very important because then we get to know that the virus we are dealing with here, is it the same as what is happening elsewhere? And if you want to introduce interventions like vaccines and others, are they going to work among us? I think we've had situations where the meningitis, for instance, the vaccine that comes in, it's not the kind of organisms we have, so they don't really work. So going forward, as an academic institution, research, we would want to also answer that question, particularly know what is around us to be able to put in the best intervention.
Currently, the UHAS lab is able to test up to 75 samples in a day, but Dr. Duedu says the school is expecting more equipment to enhance its capacity.
Here, the facility we have is a research facility which we've been working, and we volunteered some of the states. And this being an important thing for the country, we have volunteered what we have, and we need to build that capacity. So there are a number of things that we will need in order to expand on what we have currently. So things like even fridges, that when the samples come in, we have some fridges already, but we anticipate that they may not be enough to be able to keep it in until it's worked on and all that. So we need some of those things, freezers, some of the basic things that we have. We've heard the president saying they produce a lot of PPE, so we are working with the various groups to be able to make sure that we get some of the PPEs.
So beginning today, at least 75 samples of COVID-19 should be tested and either confirmed or otherwise here in this lab at the University of Health and Allied Sciences in Ho. Reporting for Citi News, my name is Benjamin.